Hi guys, it's Grace with Grace Gets Gastric, and I am here today for a Q&A video. So I am a little bit past 3 months post-op plastic surgery, and so I asked people here on YouTube and on Instagram if you guys had any questions for me, and I figured I could go ahead and answer them. So I'll go ahead and put the questions down below along with the people who asked them. Some of the questions I kind of combined if they were sort of in a similar vein, so your exact question wording might not be on here, but the spirit of your question will be answered. And I believe I've got all of them. If I missed any questions, of course, go ahead and leave them down below and I'll answer them in a comment. So to start off, we have, why did you prefer Mexico over having the surgery done in the US? I preferred Mexico because there were surgeons there that specialized in plastic surgery after massive weight loss, and where I live personally, there were really not any surgeons that specialized in that particular area, and none of the surgeons here that would do the surgery. Of course, there were surgeons who would do it. I wasn't really a fan of their results, so I went to Mexico because, in my opinion, that was where the doctor that I wanted to go was. Did you reach your ideal weight before plastics with plans to just tone up, or do you still have weight you want to lose? If so, will weight loss after surgery affect your result and possibly result in more loose skin? So I don't really like this idea of the ideal weight. I just don't think that it's really possible to know like your ideal weight. I reached a weight that I was happy and comfortable with and that I planned on being at for a while. I have no plans to lose any more weight at this point. I do plan to continue to tone up to work on my strength training. So, my body composition might change, but in terms of trying to get down to a certain weight number, I have no plans to do that. If you are planning to continue to lose a significant amount of weight, I would suggest waiting to have plastic surgery because your results if you continue to lose more weight after weight loss or after plastic surgery, you might have more loose skin. You're going to have some loose skin regardless. It's impossible to get rid of it all with plastic surgery, but yes, that will exacerbate the loose skin. Did you ask your doctor about if the breast lift affects breastfeeding in the future? I do not plan to have children. I did actually ask just because I was curious, but I don't plan on having kids, but the way that they do the lift and including with implants, there should be no issues with breastfeeding. But you should make sure that you're asking your surgeon if that is a concern of yours. Do you feel the best way to go is by getting combined surgeries? Very few surgeons in my area and country do combine because they say it's unsafe for the patients and that's a more difficult recovery process. I think that the best way to go is whatever works for you and your lifestyle. I don't think that's something that someone else should be deciding for you. For me, I did want to have multiple surgeries done at once because while it is a more difficult recovery process, it is also less recovery process overall. Some people don't have the luxury of being able to take 6+ weeks off each time they have a surgery, multiple times in a year. It is also generally reduced cost because you're only paying once for operating fees, the OR, all of that stuff. But again, it really depends on your body, your area, your surgeon. A lot of surgeons, if they do general anesthesia, most surgeons will not do multiple combined surgeries because what is unsafe is us being under anesthesia for that long. Part of why, again, I wanted to go to Mexico was because they use a combination of anesthesia and sedation. It's kind of twilight anesthesia is what it's called, but it makes it so that it is safer to be down for longer periods of time, and so you can have more surgeries done at once. But again, do your own research, look into that yourself. For me, I don't think that one is necessarily better than the other. I think they each have pros and cons. And for me and what I wanted, I felt like trying to get multiple surgeries done at once was the best for me. Did you have to stop taking vitamins? If so, when did you restart them after plastics? Again, this is something that you want to make sure you were asking your surgeon because they'll have different rules and requests depending on what medications and vitamins you're taking. I did stop taking my vitamins, I think a few days, I think a few weeks for some of them. I know anything kind of like fish oil, any vitamin A, I believe, and maybe vitamin E. There's some of the vitamins promote blood thinning, and so they don't want, or they don't want you to be taking those before you're having a surgery when you are going to have, blood flow. I honestly did not look up the exact vitamins that they asked me to stop taking, but there were some that they requested you not take. And then I started them a few days after my plastics. Yeah, I was able to start everything. But again, definitely something that you should make sure that you ask your surgeon, because they'll be able to talk to you more specifically about what you are taking. But I did send my surgeon a month before plastics, a list of everything that I was taking, and then they gave me recommendations based on that. Did you see older clients having surgery in Mexico? Yes, I did. I was the youngest person there by, I don't know, probably at least 10 years. Just when I was there personally. There were a number of women in their mid to late 50s, possibly 60s. I mean, I didn't ask their exact ages, but there were definitely a number of women that were older than myself. And I think actually the women I'm thinking of in particular, all three of them were all on their second round of plastics. So they had all come back after having undergone their first round with Dr. Galvez. So it's definitely possible, and they were doing great. After plastics, especially the muscle tightening part, did you notice a change in your restriction? Have you experienced any GI issues or changes post-plastics? So I didn't actually have muscle tightening. I assumed that I would because I have been obese for so long, but I haven't had kids and I am still relatively young, so they didn't see a need for muscle tightening. So that could play a role. I did notice an increase in restriction for the first few days after plastics, where I definitely was not as hungry and could not eat as much, but that quickly went away, and now my restriction, within a week after plastics, I would say my restriction was back at what it had been before plastics. I'm 2 years out of VSG, so there's definitely a change in restriction from, when I was first out of VSG, but I obviously do still have restriction. And then GI issues or changes post-plastics. The main thing is I have definitely experienced an increase, I would say, in gassiness, both in terms of wanting to burp and, flatulence. So I would say that I've noticed an uptick in both of those instances. The kind of chest burping thing has been, I'd say, more of an issue just post VSG. I would say in the past 2 years, I am generally more prone to burping, but it seems like maybe it's been a little bit more increased since since plastics. And then same thing with the gastrointestinal gassiness. I would say it's intermittent, but it does seem a little bit more pronounced than it had been beforehand. Generally, I would only really notice that happening if I had been eating a significant amount of sugar alcohols or particular kind. And I have not been eating any sugar alcohols at all. I've been eating too much actual sugar, and I have noticed that uptick. So, I mean, it could be totally unrelated. My diet has not been the best it has ever been, but I've definitely gone through periods in the past several years of eating a bunch of sugar, like over the holidays, and didn't notice that correlation. So I am inclined to think there is something there. And I'm only 3 months out, so I do experience a good amount of swelling. Sorry, I'm just looking at the list I have. I just wanted to make sure I don't miss anything. How bad was the pain? Did the upper body lift hurt? The pain was not that bad. I am a huge baby. I have very low pain tolerance. And if you want to know more about my thoughts in the moment, I do have a whole series of videos that I filmed when I was actually going through everything. So I talk about how I'm feeling and all of that stuff. But I would say overall the pain was fairly minimal, very manageable. It obviously existed. It was mostly discomfort, a lot of discomfort, some instances of mild pain, but not much. And I don't really feel like the upper body lift was any different from the lower body lift. It was just different because it was, goes all the way around my body. And I'd say the back lift was just... it made it so I couldn't really reach for things. And so that was more discomfort and more tugging, I guess. How did you feel after getting it? Was there bleeding? How does it feel now? Okay. Kind of a vague question. I felt, again, I really think that you should, not to plug my own videos, but it's been 3 months. And if you want to know how I felt after getting it, I would go and watch the videos that I filmed directly after getting the surgery. it felt fine. Weird. There wasn't really anything to say. Was there bleeding? I assume while I was being operated on, I bled, as one does. I did not experience any significant issues with bleeding or blood post-op. I know some people do with wounds and stuff. And I'm trying to think, I really don't think I had any instances of bleeding, like almost at all. I mean, mild instances when I would, remove the drains, when I remove the stitches, like a spot of blood here or there, but in terms of, like occasional, like little tiny scabs. But some people do have bigger wounds or bigger issues with blood, but I didn't really have any. So there's that. How does it feel now? I mean, it feels fine. I feel great. No issues really. Definitely still feel it. I don't feel like I felt beforehand, which I didn't expect to because I am missing the skin that I've lived with my whole life. There's kind of a tightness. My whole body still kind of feels a little bit tight. I can, like a little bit cinched, not in a pain way, not even super discomfort. It's more just I'm aware of it. Before it's like just your body. You're not really aware of it. And now I'm aware of my torso because I can it feels different, if that makes sense. I don't know how to explain it. I wouldn't have been able to explain it to myself pre-op for sure. How much was the cost? Was it a bundle deal? I mean, it was a bundle deal in that because I was getting multiple surgeries done at once, I only had to pay one fee for like the hospital costs, whereas, you have to pay it every time you go into the OR. So that was a bundle deal, but they didn't like give me a special price because I was getting multiple surgeries done at once. That's just not how this particular surgeon operates, and I personally prefer that. And how much was the cost? Oh God, I think it was about $17,000 all told for everything other than flights. So that's including the hospital stay, food, all of that. I do talk about costs again in those videos I made post-op. So if you want a more detailed breakdown of everything, you can go watch those videos. One of the titles talks about pricing, so that's the video. But yeah, about that much. If you didn't have the time off to burn, how long do you think recovery would have been for you between surgery and working a normal office type job at home? So in terms of going back to the office, I know that wasn't part of it, but if I would say I felt ready to go back to the office a week before I did. I was glad to have that extra week, but I could have gone back a week early. So that would have been 4.5 weeks. I could have gone back to the office. In terms of working a job at home, I would probably say, 2 weeks, in terms of, and again, yeah, like you said, it's going to vary greatly. I think, for me personally, I was very mentally affected by anesthesia when I did it for VSG. And so, one of the benefits, in my opinion, of having, the twilight anesthesia that I had for my plastics is that mentally I snapped right back. Within a day, I was totally mentally clear. So that aids in my thinking, because of that, after 2 weeks, I felt personally able to kind of do everything I needed to do. And I think I would have had the stamina to work from home as long as I was, it was like a desk, a computer doing minimal work. I would really try to avoid that if you can, because even things like lifting up a laptop, depending on what surgeries you've done, can, be detrimental. So, just something to think about. How long did you need the lift chair? So I had a medical recliner after my surgery, the kind that will lay flat and then it can also stand you up. I had it for the first 4.5, 5 weeks. And I used it every single day. I did not need it at all, I would say. If I hadn't had it, I would have been fine. I would have needed a wedge pillow, but I was able to stand myself up. And that was the big thing for the lift chair, is I was worried I would not be able to stand myself up from sitting and that I wouldn't be able to get up from lying down. I was not able to lift myself up from a totally lying down position comfortably for 6 weeks. And so I had to prop my pillows up in my bed for the next 2 weeks after I'd gotten rid of the lift chair, before I was able to kind of lie down flat comfortably and get up comfortably without feeling like I was pulling on things that shouldn't be pulled on. So, yeah, I would say I was glad that I had it for a month. I could have used it for another 2 weeks, but I did not need it at all personally. I think it might be different depending on the surgeries. I didn't have muscle tightening again too, so I think that made things a little bit easier for me. How is your energy level? Are you completely healed? My energy level is fine. In terms of post-plastics, there's no impact at this point anymore on my energy level. Dealing with depression post-plastics and during a pandemic is a different story, so my energy definitely fluctuates, but not because of plastic stuff in terms of healing. Am I completely healed? Yes. I'd say in terms of outside, all of my outside incisions are completely closed. There is no longer any scabbing, so that is all healed. At this point, I am clear to do strength training, so internally I am healed enough for that. Based on how things feel, I don't feel like everything is necessarily 100%, but you know, things will continue to heal and improve up to, you know, like the next 2 years, really. So I'm more or less healed, yeah. Is there anything else you want to have done? Yes, I would love to have my arms done. I am thinking I would like to have my thighs done, but that is a much lower priority. And then on a super low priority, if I'm getting another surgery and they're in there and they have the time or whatever, I might be interested in getting something done to my butt, because I don't have one, and I would love to have just a little something, but that is completely minuscule. That is, you know, it would be one of those things where if I'm going to get my thighs or my arms done and they have the fat and they want to inject, you know, while we're in there. And then, you know, possibly adding a bit of fat grafting to my breasts as well. Again, those last two are total bonus ones. I think, you know, we'll see where things are at in the future. How is your swelling? Do you feel like walking helps with your swelling? Do you notice if certain foods make it worse for you? My swelling is, I would say, moderate. Definitely still present. No, I don't think walking makes it helps. I think it makes it worse. In fact, that is what all of the literature and you know, my surgeon says, you know, if you increase movement because it is increasing the blood flow, it does tend to increase your swelling, which is not a reason to not do it, but that is just something to be aware of. So I think part of why it is more significant for me is because I have been going on a lot of walks and I have been increasing my exercise now that I'm cleared to. I haven't noticed if any foods make it worse in terms of how I feel. I think at this point it's doing what it's going to do. So but I haven't also paid too much attention to if I eat this then that. I just kind of think by the end of the day I'm swollen like a balloon. And that's just how it is right now. Are you still planning phase 2 plastics, or is that on hold due to the pandemic and your phase 1 recovery? How are you feeling about your scheduled round 2 since you are now 3 months out? And then having gone through this already, are you more or less nervous for round 2? So as of right now, my round 2 is still planned for the end of October. I am on the books for thighs and arms, but of course all of that is still a little bit up in the air. I've not yet bought my tickets, my flights, and I will probably not do so for a bit because though it is still scheduled, I am not sure how I feel yet about having it done. We will see as we get closer to that date. In terms of recovery and all of that, though, I mean, I feel fine to have in my next round, but it's really just the state of the world. I'm feeling good about round 2. I don't know. I'm feeling mixed feelings about round 2, to be honest. I keep going back and forth on if I think it is necessary or not. I've done this recovery, so I know that, hey, it's possible. I also think that the surgeries that I have currently scheduled for round 2 will make that recovery more difficult. And I'm worried about that because this recovery has been more or less, this recovery has been easier than I anticipated because I really went into it over preparing. And now I've seen what a generally decent recovery is, and I'm nervous about doing a second round and not having it go that way. I know with my arms, it's going to make me a lot more dependent on other people. And I am a very independent person and find constant supervision to be really stressful. So I'm a little bit nervous about that. I keep going back and forth on, do I feel like I should get my thighs done or not? In some ways I'm like, it's just going to be such a pain in the ass to heal from. But then I'm just like, if I'm going to be going under, because I do really want my arms done, you know, I might as well kind of get as much as I can. So I don't know if I don't know how I'm feeling. You know, I kind of keep going back and forth. I'm glad that I have some more time to think about it. I don't know if I'm any more or less nervous. I mean, kind of, I would say less nervous in that, I know I can get through it. I kind of know more what to expect, but more nervous, but because I know what to expect, I am fairly certain that the recovery will be more difficult for those surgeries. So, did you take measurements before plastics? Are you in the size clothes you thought? I did take measurements before plastics. I have not yet taken, my post-plastics measurements, partially because I'm a little bit higher up than I want to be, partially because, with all of the quarantine, I haven't seen my sister yet. She's the one who took my measurements, and I actually tried to take my measurements without her just, you know, a few days ago, and I couldn't get the numbers right or the tape right, and I didn't remember where she'd put it, so I just prefer for her to do it just for consistency's sake. So have not yet taken another round of measurements. As for in the size clothes, if I'm in the size clothes that I thought I would be, I did not think about it in that terms, and I think it's dangerous to do that because you're setting yourself up for disappointment. Your clothing oftentimes will not change all that much after plastics, from what I've heard and my own personal experience. I'm in the same size shirt I was in beforehand, and I don't really know what pants I was in before, but I think I'm smaller, but not by a ton. And you know, for how much skin they removed and how much that stomach was hanging there, you would think it would be a lot different, but it's not. So, I didn't actually have a thought about what I would be, and luckily that means I'm not disappointed by the fact that I haven't changed all that much. And I was happy in the size clothing I was in before. It was not about size or numbers for me. It was about, you know, like just having the skin gone and like the optics of that, I guess. How are your scars? My scars are fine. They're there. I talked to my surgeon a few days ago, sent him like my 3-month update, and he was saying they looked really good. They are, you know, not over, you know, like my back scar is pretty dark and a little bit wider in places where I clearly overextended myself a little bit reaching for things. I would say they're going to continue to improve over time, and I'm excited for that. They are quite dark, but I expected that would probably be the case because I historically have quite dark scars when I've had, like when I had my VSG, the scars were quite dark. So I kind of expected that, and yeah, but I have no problem with my scars. But I kind of went into this expecting that they were going to be quite prominent, and they are pretty prominent, but that works for me. Are you happy with your results? Would you still recommend your surgeon? Yes, I'm very happy with my results. I'd absolutely recommend my surgeon. I think he did an amazing job. Given what he had to work with, the amount of skin, the quality of my skin, how much he had to cut me up, it's amazing what he's able to do. I think he really is, he's got a great aesthetic, he's got a great eye, and he really does what he can to give you your best shape. You know, he's not building or creating things that are not necessarily possible or there. You know, he's not overly snatching your waist to the point of like not being safe. But you know, he kind of, I had this shape underneath my skin and he brought it out for me. And I'm really happy about that. So yeah, I think he did an excellent job, and would definitely recommend him. And I'm still planning to return, you know, as of right now, I'm planning to return to him. And if I don't, it has nothing to do with him as a surgeon, and it would have to just do more with the state of the world and my own feelings on my body. So, and finally, what most surprised you about your body after plastics? It's kind of, I hate those questions. Not that I hate you guys for asking them. I love when you guys ask questions. It's just so hard to say. Because it's not so much, you know, like what does surprised mean? There were things that I thought could happen or expected might happen, but actually experiencing them is a completely different story. My boobs are kind of the weirdest thing for me right now. I'm really getting used to them. I don't know how I feel about them, and not in a, yeah, I don't know. I think just, I've never had boobs like this, and like, it feels like the nipples are very high, and I trust that the doctor did put them where they were supposed to be, but I'm just like, that feels like a weird spot because they have always basically been pointing downward, you know, almost inward with how much they were hanging, and they're just smaller, and they feel quite small, but they're also, like, according to clothing, apparently not as small as I think, because they're still busting out of stuff. So it's just, you know, I'm not used to breasts like this, and so surprised sounds like not the right word, but I think it is one of the bigger adjustments. I'm not quite sure how to dress them. I can't get bras right now either because of the pandemic, and that's really frustrating because I don't know what size I am, so I can't order anything, and I really want to get professionally sized because I'm just confused about how to deal with them because I've just never had to. And I feel like dealing with a lack of stomach is totally straightforward, but new boobs, that's very weird to me. So I think that's maybe the biggest surprise. I mean, my pee stream is like practically, you know, horizontal at this point, which is very strange to try to remember. It's very surreal to like put on underwear and have it lie flat against my stomach, and like look like underwear is supposed to. That's very weird. Sometimes like I find myself a lot kind of awkwardly rubbing against my mons, essentially, you know, like, because it's just flat, basically where my penis used to be, you know. It's not like a creepy thing, but more of a just like, oh, like I just can go straight down from like my stomach all the way down, and it's just like one smooth flat surface, and it's just, it's so weird to me. And so, and I used to kind of play with my skin, for lack of a better word, but you know, like it was there and jiggly, and so now I don't have it, and so I think I'm just, it's like the residual. It's almost like I'm expecting to have skin down here and I don't. So yeah, there's that. Anyways, I think that was all of the questions. Thank you guys so much to everybody who asked them. I really appreciate it. It's always a little nerve-wracking when you ask for questions because you're worried no one will ask any, but y'all came through. You always do. Like I said, all of the questions that were asked and who asked them will be down in the description box. And if you have any other questions that I didn't answer here or that I forgot to answer, go ahead and leave me a comment. I'm happy to answer them. And I will also link below my plastics playlists if you are interested in actually hearing about things as they happen and my fresh thoughts. I pretty extensively documented, particularly like the first few weeks. So those are there for you as well. Anyways, thanks so much for watching. Thanks for being here. I hope you all are doing well, and I will talk to you all very soon.